Good afternoon. It's May
Hello.
20th, and we're here with Dr. Frankovich, who's answering questions from local media. The FDA has approved emergency use authorizations for several dozen molecular COVID-19 tests to date. Which one is Humboldt County's public health lab using?
Well, we're actually using, it's an RT-PCR test. It's probably the most highly sensitive test, or among the most that are available. It's the same test that was basically distributed by the CDC in this outbreak when other testing was not yet available, those other options, but it really is one of the gold standards.
Is it possible to get a breakdown of the percentages of people with confirmed cases who presented with the most common symptoms of COVID-19? For instance, what percentage of people presented with a dry cough, fever, shortness of breath, etc.?
Well, it's a good question, and it really goes to the point of the fact that we know that the symptom range is much broader than originally thought with COVID, and includes things like headache and muscle aches, sometimes diarrhea, sometimes just some other more vague symptoms like sore throat. And so we do collect that information. So I'll talk with our epidemiologist and see if there's a way, at least on an intermittent basis, we can update people on what that's looking like.
Of those with confirmed active positive tests in the county so far, how many are asymptomatic, how many have symptoms and are managing at home, how many are currently in the hospital, and how many are currently occupying beds in the ICU? Readers have been asking us for a precise look at this.
Sure. So, basically, when we look at these individuals, one thing that the community can look at is the active, the positive cases, and the number that are recovered, or active versus recovered, I think is the label that we put on. That will tell you on the people who have been removed from isolation. And so they've met those criteria at this point of having had no fever for 3 days without medicine. They have improved symptoms, and that it's been at least 10 days since the onset of their symptoms. And so that's one easy way to tell how people are doing, basically when they come out of that isolation period. We don't comment on people's specific who is in the hospital, who is not, but you can certainly look at the total number of individuals of our positives who have required hospitalization by just looking at the hospitalization number.
Thank you. Where did the COVID positive asymptomatic people from Alder Bay, or homeless for that matter, go to quarantine?
So in a facility where there's a congregate facility such as Alder Bay or any assisted living or skilled nursing facility, those individuals are isolated in their quarters. And so in some places that's much more of like a little apartment or room for them. We basically, the model is to use full PPE going in and out of those rooms, trying to use the same staff as much as possible so that there's just limited interactions there, minimizing the number of people going in and out of the room. So there are ways we try and work to keep that individual rather contained in terms of exposure to others. It's a different matter when we're talking about homeless individuals. So with homeless individuals, it's important for them to have somewhere to be while they're in isolation because they're positive. And so they would go into lodging that we've set up through the county. And they are in that. We help to support them in that environment until they come out of isolation or quarantine.
Thank you. Mm-hmm. Is the Department of Health and Human Services concerned about a coronavirus outbreak at the Alder Bay facility? And if so, what measures are health officials taking to monitor the situation?
So we obviously have an outbreak at the Alder Bay facility. Again, as we've talked about, it is these, in particular, assisted living facilities are challenging for these outbreaks. We've been in contact with the California Department of Public Health since the beginning of these cases in the facility, and we actually have had them on ground here for a few days now, also sort of assisting with the facility and assisting local efforts with it. So that's been of great help. Certainly they're familiar with this process as we've been seeing this in facilities across the state.
Could these two deaths impact Humboldt's reopening efforts, and if so, how?
So what I would say is that no single piece of data dictates us moving forward. The deaths are obviously difficult for us and sobering as we move forward. But in terms of our local situation, we need to take in the full context of what's going on in the community. Do we have hospital capacity? Do we have contact investigation capacity? What do our other epidemiologic numbers look like? All of those are taken into account when we go forward. So again, as much as we regret these, it doesn't necessarily change the trajectory of what we're doing going forward.
I understand that you stand firm on the concept of sheltering in place and that Humboldt County residents are asked to remain home as much as possible, but yet discussions are continuing to reopen more non-essential businesses. Don't you think this is a contradiction?
Well, I understand the question, but what I want to say is I think we've all agreed as a community that there's no way for us to remain in shelter in place until a vaccine is available or therapeutics, because we don't know what that time frame is. And staying as we are in this very restricted environment is also a health threat and societal and economic threat to people in our community. And so I think we are in general agreement we need to move forward. The only question is pace. What I would tell you is that one of the important features about moving forward is that we try and control the number of things that are changing all at once. So while we recognize the need to get some businesses open, we're asking people to still not spend the kind of time outside their home, for instance, extended shopping, those kinds of things, or doing so in groups, etc., that they might have enjoyed before. We'll get there. We're just not there yet. And so I think it's not a contradiction in the sense that we need both things to happen. We need people to still be limiting their activity, and we need to start opening.
If the mass population has the okay to shop or frequent non-essential businesses, why not approve people to attend self-help or support groups as a mental health tool? And what would the criteria for approval of that be for Humboldt County?
So I understand that that's a need. And it really goes to this issue of the number of people that can gather, right? And so I know some groups have been meeting through technology such as, Zoom and various things, and that has been helpful. I agree that it's always great to be able to meet in person. So what we're really looking at is when is that moment. Right now, the state has not put out guidelines about the number of people gathering outside the household unit. Again, when we speak about those number of changes, people need to understand that increasing our group sizes increases exposures. And so we plan to do it. It will happen, hopefully very soon. And we'll certainly make sure people are aware of that.
On Tuesday, the sheriff was asked about Bear River Casino reopening this weekend, and he said the public health officer has come out and said, we don't believe this is a good time for them to open up right now, and we strongly recommend that they do not. Why do you believe it's not in the public's best interest, for casinos to reopen right now?
So again, it speaks to some of the things we've alluded to in this conversation is that the gatherings of people is a significant risk. And as we look across the country at some gatherings that have occurred in a variety of settings, these larger gatherings have a potential to allow a lot of transmission of virus. And so my concern in the casino setting is, again, as careful as they might try and be in structuring the work environment, the individuals operating casinos, you cannot get away from the fact that we're pulling large numbers of people into a common space indoors for extended periods of time. And as we've seen in our scenarios in our community, we have had individuals who have had absolutely no symptoms initiate outbreaks. And I think that is going to happen in our community. I just don't think it's the right time to introduce that type of exposure in a large setting.
Eureka saw a second death in an Alder Bay resident reported Tuesday. How are residents who contract COVID at Alder Bay being quarantined to minimize risk of spread to others?
And I think we covered that question previously.
Thank you very much, Doctor.
Thank you.